Good afternoon, I'm Vashon Brown with the Midday News. A special welcome if you're watching on onespotmedia.com. The Ministry of Health is considering to transform the National Arena in St. Andrew into a field hospital as it tries to deal with a possible upsurge in coronavirus cases. Permanent Secretary in the Ministry of Health, Dunson Bryan, says the project is estimated at $182 million. As it is now, the facility can house up to 72 beds and can store up to 8,000 gallons of water. Mr. Bryan gave details at a virtual Special Select Committee meeting this morning.
We looked at our scope of work in terms of what was required for us to establish a field hospital for the national arena, as to transform the national arena as a field hospital. Next, we are finalizing this design based on consultations. Just some minor tweaks will be required. And then next, the financing is $182 million. Cabinet has asked that the lead on the implementation of this action will be the Jamaica Defense Force.
Now, several countries, including the United States, have opened up field hospitals as they try to deal with the surge in COVID-19 cases. Some states, like New Jersey, for instance, have used the field hospitals to treat non-COVID-19 patients in an effort to alleviate hospitals overrun with coronavirus patients. There was chaos in the old capital's Spanish town in St. Catherine Monday as scores of persons descended on the post office to access state funding. The occasion proved a challenge for authorities, as Dwayne Anderson now reports.
Dozens of persons converged on the Spanish Town post office in St. Catherine on Monday. Some were there from as early as 5 a.m. Funds from the Program of Advancement through Health and Education Path were being paid out. These crowds are not unfamiliar on payment days, but with COVID-19 around, this crowd was a big problem. Several police officers as well as a health department worker tried to get some order and have the people space out, but to little effect. Social distancing was the last thing on most persons' minds. Getting to the servers' windows to get the path cash was more important. A police officer helped the under-pressure post office staff by calling out names from a book. That seemed to have brought a little more order to proceedings. As persons grew restless, the police threatened to use their non-lethal gear, including pepper spray. Thankfully, it did not reach that far. A frustrated parent vented to TVJ News.
From morning we there around here. Around here to the worst at a place, part of pay come on here so. Then on the manner, then on the discipline, them know nothing about them. And then lead down old people, then stop up them one another around here if you don't mind. So I first ever come on here and I want to go on. I pay around here.
She suggested a change in the payment system to make it easier to collect in the future.
What them supposed to do? If them take Rivali, make Rivali come today, and then make different era come different day, and it is better.
Dwayne Anderson, TVJ News.
Associate Professor in the School of Public Health at the University of Technology, Dr. Alverston Bailey, believes all persons who entered the island after March 18 should be found, tested and placed in state quarantine to help stem the spread of COVID-19 locally. The government has been trying to get these persons to contact the Health Ministry to report on their health status and to self-quarantine at home. However, Dr. Bailey says the government needs to go further.
And my opinion, too, is that it should not only be identified, but I'm a serious proponent of testing. They should be tested and then quarantined and then retested in 14 days in order to determine if they are in fact carriers of the virus. Because as I told you back in the middle of March, there's compelling evidence around the world that asymptomatic persons can in fact spread the virus.
Dr. Bailey is not in agreement with the idea of self-quarantine.
I think persons who are at risk should be quarantined under the government's control. They should a controlled quarantine, I think.
Why you don't believe in involuntary quarantine?
Because as a rule, human beings are difficult. And my take on the matter, and I'm speaking to you now from Trelawney, a significant number of the persons in Trelawney that speak with really do not take this thing seriously. They don't. And I'm convinced that despite all the bad news coming from overseas, a large percentage of Jamaicans still do not really believe that COVID-19 is a clear and present danger.
Dr. Bailey says the government should have been monitoring all persons who came into the island recently, starting with a flight on which the first patient who tested positive for COVID-19 arrived. The Health Ministry has launched a wide-scale search for more than 4,000 people who arrived in Jamaica after March 18 and have not reported to the health authorities. Now, Dr. Bailey was speaking on Radio Jamaica's Beyond the Headlines yesterday. Minister without portfolio in the Ministry of National Security, Matthew Amudha, says Sunday's disturbance at the Richmond Farm Adult Correctional Center in St. Mary is an indication that the release of low-risk prisoners or detainees in response to the coronavirus crisis is not a simple matter. Recently, human rights advocates lobbied for the government to release certain categories of inmates because the crowded prison system and the implications if there is an outbreak of COVID-19 at detention facilities. The National Security Ministry indicated that the matter was not up for discussion. Mr. Amudha said had consideration been given to the request, some of the inmates would have come from the Richmond Farm facility.
Well, the classification of persons in a medium to low security facility with 3 to 6 months on their sentence were some of those that proposals were being made for release. And these are still the same persons that were partaking in a smuggling operation to bring in contraband and were willing to attack BCS waters. It's not a simple consideration. At the end of the day, whereas we do have a duty of care to those who are in our custody, we also have a duty of care and extreme duty to protect citizens and the victims of crime.
No need to fear, words of encouragement from the president of the Nurses Association of Jamaica, NAJ, Carmen Johnson, to her members. Last Thursday, it was revealed at a parliamentary committee meeting that the health ministry is behind with its testing because healthcare workers are fearful of carrying out the procedures. Shamela Pullen reports.
The current method being used to test for COVID-19 in Jamaica is the swabbing of the nose or back of a person's throat. This procedure can be risky as it puts the healthcare worker at risk for contracting the virus. President of the Nurses Association of Jamaica, NAJ, Carmen Johnson, says these procedures are normally done by a medical doctor or someone who works in a lab. However, due to the limited numbers of these individuals, nurses will oftentimes have to assist. But the challenge is some of these nurses are reluctant. Ms. Johnson says she understands, but given the nature of the crisis, all hands must be on deck.
I know some of you are still fearful because you are single mothers. You have your family members at home who you have to care for. You may be the major breadwinner. And at the same given point in time, you want a lease on life. And so with all the knowledge and all the new findings that we are learning about COVID-19, it does get some of you unstable. But I say to you, you are able to do it. You can do it.
Ms. Johnson added that with the limited numbers and lack of resources in the sector, they have still managed to record some successes, with 2 persons, one from St. Anne and the other from St. James, recovering from the virus in recent times. She calls on her nurses to go back to the drawing board and familiarize themselves with the various procedures for more testing to be done.
So I want to say to each and every member, and each and every colleague, every midwife, every nurse, start being prepared. For those of you who are still fearful of participating in this war, we say to you, re-educate, resensitize yourself. Continue to practice your donning and doffing of your PPEs so that when it comes to the point when you'll need to use them, you are confident enough that you are protected and that you are able to do what you must do.
The NAJ president said chances are the number of confirmed cases will go into the hundreds, and so they're trying to be as prepared as possible for when this happens. However, she said while they're doing their part, it is critical for Jamaicans to do theirs. This is by practicing physical distancing and other measures outlined in order to keep the curve flat. If not, then they are only making the situation worse.
Once we can keep the curve flat, then we will be given the opportunity to care for each and every individual that comes into our facilities. But when you don't do that, and we have an overwhelming number of persons coming in that needs care, it simply means you may be the next patient who arrives in one of our institutions and we have no bed space to put you, or we have no healthcare person available to take care of you. So I say to you, let us play our part. We are staying in the hospitals for you, and we want you to stay home so that we can work together and make it a better Jamaica.
Shamela Pullen, TVJ News.
And we now take a break on the Midday News. We'll be right back. Please stay with us. Welcome back. Continuing the news now. The UN's Labour Organization estimates the equivalent of 195 million full-time jobs could be lost between April and June alone from the COVID-19 outbreak, with businesses and plants shut worldwide. The projection from the International Labour Organization is based on an emerging impact of the virus, and it amounts to a big increase from its March 18 prediction of an extra 25 million job losses for all of 2020. ILO Director General Guy Ryder says these figures speak powerfully for themselves, that the world of work is suffering an absolutely extraordinary fall. The agency says full or partial lockdown measures now affect nearly 2.7 billion workers, or about 81% of the global workforce. Some 1.25 billion are in hard-hit sectors such as hotel and food and services, manufacturing and retail. Time now for sports. Just over 2 weeks after hinting to TVJ Sports that there was a likelihood the race's Grand Prix could be postponed due to the continued spread of COVID-19, President of the club Glenn Mills on Monday confirmed that the decision to postpone was communicated to World Athletics in recent days. The race's Grand Prix is one of 10 meets which was awarded gold status in the newly formed 2020 World Athletics Continental Tour last year.
The summary of everything is that based on the current world conditions and uncertainties, we postpone the meet pending further. Well, we don't know what's going to happen. So in due course, we will have to make a decision whether we'll have a meet or not. But for now, the best we can do is postpone it.
The meet, which was originally scheduled for June 13 this year, was set to have core events such as the triple jump, discus throw, 3,000-meter steeplechase and a 200-meter, which were cut from the Diamond League. Mills, who chairs the organizing committee, says the decision to postpone the Grand Prix was straightforward, given the global restrictions on traveling and quarantine procedures.
So there's no need to consult, because everybody have a front row seat of what is happening, unfortunately.
Now, the Continental Series was set to begin on May 10 in Tokyo, Japan, and would also include meet in the Netherlands, Finland, and Poland. And that's the Midday News. I'm Vashon Brown. Join us at 7 for a primetime news package. On behalf of the news, sports, and production teams, have a good afternoon.